There are certain numbers on your blood test that can quietly predict a heart attack, the onset of diabetes, cognitive decline, and other chronic conditions years before symptoms appear. Most standard lab reports ignore them. Your doctor might glance at them and move on. If you know what to look for, these values provide some of the most important information you will have about your health. Let's break down all 10. Welcome to Opti Labs, where we decode your lab results and uncover the deeper story behind the numbers. I am Dr. Austin Odige. Number 1. Fasting insulin. Most standard metabolic panels don't include fasting insulin, which is remarkable because it may be the single most sensitive early warning sign for metabolic disease. Insulin is the hormone your pancreas releases to manage blood sugar. When cells stop responding to insulin efficiently, the pancreas produces more and more of it to compensate. Glucose stays normal for years, but insulin is already elevated, signaling a process that leads to prediabetes, type 2 diabetes, cardiovascular disease, and even certain cancers if left unaddressed. Ask your doctor specifically for a fasting insulin test. Optimal is 8. Anything above 15 warrants a real conversation about diet and metabolic health. At number 2 is hs-CRP, high sensitivity C-reactive protein. CRP is a protein the liver produces in response to inflammation. The standard CRP test catches acute inflammation like infection or arthritis flare-up. The high sensitivity version, hs-CRP, is used to detect low-grade chronic inflammation, the type that simmers for years quietly and accelerates atherosclerosis, brain aging, and joint damage. An hs-CRP below 1 is low risk. Between 1 and 3 is moderate. Above 3 is high risk for cardiovascular disease. Above 10 suggests active acute inflammation. If your hs-CRP is chronically elevated and your doctor hasn't brought it up, ask why. Diet, stress, sleep, and gut health are major drivers. This number is actionable. Number 3. Triglyceride-to-HDL ratio. Most people get fixated on total cholesterol or LDL, but the triglyceride-to-HDL ratio is actually one of the better predictors of cardiovascular risk, and it reflects insulin sensitivity better than LDL does. To calculate it, simply divide your triglyceride by your HDL. Below 2 is ideal. Between 2 and 3 is borderline. Above 3 is a meaningful warning. Above 4, and you're in a territory that warrants serious attention. High triglyceride to low HDL is the hallmark pattern of insulin resistance. You can have a normal LDL and still have this pattern working against you. Ferritin is number 4. Ferritin is your iron storage protein. It is different from iron or hemoglobin measured in a CBC. You can have normal hemoglobin and still have depleted ferritin stores, which causes brain fog, fatigue, hair shedding, or reduced athletic performance. For women especially, ferritin below 30 is almost universally associated with symptoms, even when anemia is absent. Optimal ferritin is generally considered 70 to 150. On the other side, very high ferritin above 300 in men or 200 in women can be a sign of inflammation, metabolic syndrome, or less commonly, a condition called hematochromatosis, which causes iron overload. Homocysteine is number 5. Homocysteine is an amino acid produced during protein metabolism. When it accumulates, it's directly toxic to blood vessel walls, and it's associated with accelerated risk of cardiovascular disease, stroke, and dementia. Normal is listed as below 15, but research ties elevated risk to levels above 10, and optimal is below 8. High homocysteine is almost always driven by B vitamin deficiency, specifically B6, B12, and folate. It's correctable with targeted supplementation, but most standard panels don't test it. At number 6, we have vitamin D. Vitamin D functions more like a hormone than a vitamin. Receptors for it are found in virtually every tissue in your body. Low vitamin D is associated with low immunity, depression, bone loss, poor insulin sensitivity, higher risk of cancer, and worse cardiovascular risk outcomes. Most labs flag deficiency below 20. Optima is broadly considered between 40 and 60 nanograms per milliliter. Given that the majority of people in most countries are below optima, and that the only real risk from supplementing is if you go too high, this is one of the easiest and highest impacting numbers to address. Number 7, hemoglobin A1C and fasting glucose together. Hemoglobin A1C is a snapshot of your average blood sugar over 3 months. Fasting glucose tells your specific blood sugar at this moment. Together, they tell a more complete story. If your fasting glucose is 94 and your HbA1c is 5.5, both are technically normal. But that combination, trending upward over several years, is a very early warning sign of metabolic stress. Catching it here before you hit 100 on fasting glucose or 5.7 on HbA1c is the ideal window to change the trajectory with lifestyle. eGFR, kidney filtration rate, is number 8 on our list. eGFR is calculated from creatine levels, and it estimates how well your kidneys filter waste from your blood. It is part of standard metabolic panel, but most people don't know what it means. Above 90 is normal. Between 60 and 90 is mildly reduced. Below 60 for more than 3 months suggests chronic kidney disease. The tricky thing is that kidney function declines with age, dehydration, certain medication, and uncontrolled blood sugar or blood pressure. Catching a declining trend early matters. Number 9 on our list is TSH and free T3. TSH is the standard thyroid screening test and is effective at detecting obvious thyroid problems. However, in subclinical hypothyroidism, TSH may still be within the laboratory's normal range even while symptoms like fatigue, low mood, hair shedding, cold sensitivity, and depression are already present. Adding T3 gives you a picture of the active thyroid hormone available in your bloodstream. Even with a normal TSH, low free T3 means your cells aren't receiving adequate thyroid signal. This is one reason why some people don't improve on standard thyroid treatment unless T3 is directly addressed. And finally, number 10, ApoB, apolipoprotein. ApoB is one of the more advanced lipid markers and one of the most powerful predictors of cardiovascular disease. Every LDL particle, every VLDL particle, every particle that can deposit in artery walls carries exactly one ApoB protein, which is more predictive than LDL cholesterol concentration alone. You can have an LDL of 120 with a high particle count, which is riskier, or an LDL of 120 with a low particle count, which is less risky. ApoB tells you which situation you are in. This test isn't ordered routinely, but it's widely available and worth discussing with your doctor if you have any family history of any heart disease. So those are the 10 numbers I want you to know about and track over time. They don't all need to be perfect all at once. They don't all need to be tested in the same panel. But knowing they exist, knowing what they mean, knowing the difference between normal and optimal for each of them puts you in a fundamentally different position when it comes to your own health. In the next video, we are going to tackle something a lot of people talk about but hardly ask: why large reference ranges can actually be misleading and how the system was set up in a way that may not save you.